Hello everyone, good evening. I hope you're all fine. I'm so excited today to see all of you. Yeah, today kindly share the video and share the link to your loved ones and friends, and also very importantly, stay true to the very end of today's discussion, because today's discussion is so amazing. We're going to look at very important stuff. There are some things people living with heart failure should not do. So don't forget to pass this video to your friends and loved ones, someone you know who is actually having heart failure. There are some things he or she needs to do, and there are some things he should avoid from. So that's all we are going to talk about today. So share this video to your loved ones and friends, and let me know where you are watching us from. You can leave a comment in the comment section as well, and I'll be glad to respond to your comments. So let me know where you are watching us from. Hello, so today that's what we're going to talk about. We are going to look at what are some of the things people with heart failure they need to avoid. So, Kes Talking Card, thank you so much for joining today's live stream. I really appreciate you, and I really appreciate all of you for joining as well. So, yesterday we looked at some statistics of people who are at risk of getting heart failure. We first of all defined, all right, I can see Rosemary Gonzalez. Thank you so much for also joining. I really appreciate you joining. Hello, everyone. Claire Kirotabayong. Pardon me if I got the name wrong. Okay, thank you also so much for joining. Okay, Bruce. Is that I should speed? Oh, no, this is not I should speed. All right, so we are here to discuss everything health. Okay, all right, monkey. Okay, you are here to discuss everything health. Okay, so thank you for joining through. So today we are going to look at there are things that people who are living with heart failure should avoid. So that's what we are going to look at. Okay, so yeah, Rosemary Gonza, thank you for reacting. You can kindly join by leaving a comment in the comment section, and don't forget to share this video to your loved ones and friends. So as I said, I'm going to show you 10 things that you should avoid if you are living with heart failure or you know someone with heart failure. There are 10 things they need to avoid. So let's go quickly into the video. Yeah, so um, if you have been following us for a quiet number of time, we have been talking about heart failure. Alongside as we are doing the discussion, please kindly you can drop your questions, any question you would like to ask. I'll be glad to answer those questions as well. All right. Talking cat, you can drop your comments as well. So the first thing that you need to do is that do not stop your medications because you are feeling better. So yeah, do not stop your medications because you are feeling better. Usually people who are living with heart failures will sometimes when they come to the hospital we put them on medications, and as the medication is working they sometimes feel like they are better, but heart failure is actually a chronic disease. And so if your medications are working and you are feeling better, does not mean that the heart failure has stopped, but rather you rather need to still continue your medications, because stopping suddenly can cause what we call fluid overbuild, and then the heart can deteriorate again, and then that can be more dangerous. Okay, so you don't have to stop your medications abruptly. You have to continue your medications and be coming for review. Okay, so you can ask me any question. All right, any question. Cleucayo Tabayong, Rosa Maria Gonzalez. Thank you all for joining. I really appreciate that you join and you find some time to join today. All right, so that's the first thing that people with heart failure needs to do. You need to avoid, or you need to do not stop your medications. And even it applies to people living with hypertension. Okay, so if you know anyone who is living with hypertension and then he's taking his medication, then all of a sudden he decided to stop, you should also be mindful of, because once you stop abruptly, you put pressure on the heart. The medications help the heart to do its normal function. If you remember the last time I was describing what a heart failure is, I said we don't just talk about the structural difficulty of the heart, but also the function of the heart. So put the function and the structure um, impairment, then we call it heart failure. Do you get it? So share the, don't forget to share this video to your loved ones. Rosemary Gonzalez, I hope you have shared this video. Thank you so much for sharing. Thank you so much for sharing. And let me know where you are watching us from. Where you're watching us from. Whether you're watching us from Nigeria, America, London, Togo. Yesterday we had people from Algeria watching us from, and people taught me how to speak Arabic. Yeah, and I remember they said, I have my notes here. They taught me Arabic, mahaba, which means thank you. Yeah, yeah. That was it was uh, yeah. There was one lady or one gentleman, I don't know. He taught me Arabic, and it's called mahaba. So you can also teach me something new, your language. Let me know where you are watching me from, and and let's learn something new. Okay, we all learn something new every day. Into this, who is this? Cleo Kayo Tabayoyong. I do not get your message, but I don't know if you're having some broken hearts. All right, but then if you're having some broken heart, it's something that emotionally we can manage with. You have to find a positivity in what you are going through, and give yourself some time to heal. And yeah, basically that's what I can say around that. Yeah, yeah, emotional healing is part of healing. Okay, so let's continue. I said I'm going to give you 10 things that you need to avoid if you know someone living with heart failure, or probably you may be living with heart failure stuff. The second thing is, do not take too much salt. Okay, simply do not take too much salt, especially if you are living with heart failure. Salt found in food, processed foods, the food you prepare, like salted fish, canned products that contains like smoked or salted fish, all those kind of stuff that contain a lot of salt, people living with heart failure should avoid. Oh, Cleo, Cleo, Cairo, Tabayong, I want to hear from you why the broken heart emoji. Probably something more you want to communicate. So share it with us. We are all learning. We are all learning something new. So yeah, let me see. So what salt does is that wherever salt goes in the body, water follows. And so salt is like a sponge that will help accumulate water back in the body. And so there's increased water, the heart now will try to pump more. And because salt is increasing the body, water becomes more, and the heart tries to pump, overdo it well because the water has become more, which kind of there's a build up of fluid inside, and so then eventually there'll be accumulation of fluid, and that can worsen the ongoing heart disease. Please, do you get it? Exactly, exactly. So, oh, my good friend, Kes, talking cat. Today I'm not seeing you. Don't you have any news for me today? Like yesterday, we were able to chat so nicely. Yeah. So my good friend, Usamaria Gonzalez, you can also share with me any question you'd like to ask me. It may not necessarily be what we are discussing, but then as we are discussing about things that people living with heart failure should never do or avoid, you can ask me and I'll be glad to go through with that as well. Okay, so feel free. We are new families. Hello, Anki. Anki said hi. Hi, nice meeting you. Okay, he said bowed, small hair. Okay, I'm not bowed anyway. I'm not bowed. I'm not bowed. Okay, yes, I'm not bowed. All right. Yeah. All right. Okay, sure. So, but probably we'll find some time and talk about badness and you know how it links to genetics and some of the treatment for people living with badness. Okay, so Claire Kayo Tabayong, we'll talk about it very soon. Yeah, and so probably if we know of anyone having badness, we can give some medications for the person and some lifestyles. We'll look at all those kind of stuff. So kindly stay true in our subsequent lives. You'll be able to find out the very natural ways of kind of yeah, my real name is Dr. OPJ. That's my name. That's my name. So Dr. OPJ, you need to know me as Dr. OPJ. And yeah, Dr. OPJ. Yeah, Bakari Cleocayo Tabayong. I think I'm getting your name right? You can also tell me your real name as well so I get to know you. Well, but the same way, I also welcome Anki05. Thank you for joining. I really appreciate you. You are now my new friend. Who is this? Got me. I don't. Your real name, right? So share with me your real name as well, okay? Yeah. So because once we are friends, we need to have names. We need to have contacts. I mean, I should call because like Care Talking Cat. I can remember him because he joined yesterday and he had a wonderful time yesterday. I got to know more about him. I got to know about the kind of games he likes, cartoons he enjoy. I mean, he shares some few things with me. Likewise, yesterday I met Nina, and Nina was teaching me Arabic. Yeah, Abraham Tete. Okay, Abraham Tete said hi. I think is it the Abraham Tete I know? Yes, it should be you. If it's the one I know, I say hi to you as well, and thank you so much for joining. All right. Thank you so much. I really appreciate you subscribing to this live stream. Yeah. So as moving on, you can ask me every question you want to ask me. It may not necessarily be what we are doing, but then I'll be glad to answer them as well. So we are talking about 10 things people living with heart failure should avoid. All right. So we are about mentioning the third thing. The number three, or the third thing that people are living with heart failure should avoid. You can share this video to your loved ones and friends as well. So the third thing, um, yeah, the third thing they need to avoid is do not smoke. No, and I'm sorry about that. Oh, okay. He said he wanted to test my mask. Okay, okay, okay. Yes, the people join live, and today someone is asking me, you want to test? We are into it. Let's try. One plus one. Oh, one plus one. Yeah, I know people may say it's 11, but it's two anyway. Yes. So, as I was saying, okay, 6 plus 7 is 13. Okay, it's 13. Yeah. Okay. So as I was saying, the third thing is that you need to avoid smoking. So smoking also worsens the ongoing heart failure and also reduces the oxygen supply and damages the blood vessel. All right. So I've mentioned three things that heart failure, people living with heart failure should avoid. Or you can ask me any question and I'll be glad to ask. All right. Any of the questions you would like to ask me. Yeah, it's 2026. Yeah, it's 2026. Yeah. All right. Then the fourth thing that people living with heart failure needs to avoid is they need to avoid drinking excessive alcohol. If you remember the previous live we went yesterday and yesterday back, I still hint on, I talked about the alcohol and risk factor, alcohol and smoking being one of the main modifiable risk factors that can cause heart failure. Remember I said something about modifiable and non-modifiable. Modifiable are the ones you can do something about it and they can lead to heart failure. The non-modifiable are the ones you can't do much about it, like the age. The older you get, the more your chances of you getting heart failure. And I also said if you're a male, that is, it increases your chance of getting heart failure. Then I also mentioned that people who are blacks, or yeah, have an increased risk of getting heart failure compared to people who are white. That's one of the risk factors. And also, if you have a known family, let's say your mom or your close relative had heart conditions, especially heart failure, you also have a risk. That's a family history of heart failure. You also have a risk of getting heart failure compared to someone whose family or relative never had heart failure. So that's one of the things you can't really do much about. Those ones are called the non-modifiable risk factors. Okay, so I think that was what we talk about. So one of the things, number four, one of the things people with heart failure need to avoid is alcohol intake, because alcohol intake also does the same thing. It worsens the heart muscles and weaken the heart muscles and triggers some kind of yeah, it worsens the heart muscle, triggers some kind of reactions and weaken the muscles and the blood vessels and eventually. And then if you remember the last time when we were talking about alcohol, I said something about alcoholic cardiomyopathy or alcohol cardiomyopathy, where I said that long-standing alcohol intake worsens the heart muscles and eventually it loses its elasticity, becomes big and cannot contract and relax to pump out blood. If you remember, I said something like that. Yeah, 2026. It says 6 plus 7 is 13 and 26. So I don't know, 2026. Has it changed? I don't know if it's changed, but it's 13. You're right. Yeah. Okay. Can ask all your questions. Okay. Let's see how it goes. Abraham Tete, you can ask a question. I really appreciate you joining. Um, you said hi. You haven't asked any question. Just ask me any question you like to ask. Rosemary Gonzalez. Yeah, you can ask a question. And as well, today, one of the person who's asking questions is Claire Kayo Tabayong. Yeah, I think a good friend. I've got a new friend. Nice meeting you. Oh, but my good friend, Kes Talking Cat, today just said hi. You did not say, you not ask any question. Or I should ask you a question. All right, all right, all right. Okay, so let's look at the number five things that, or the fifth one that you need to avoid people living with heart failure. Okay, I've mentioned, let's write it down. So if you remember the first thing I mentioned, you can write it down. What did I say was the first thing you need to avoid? Is you're supposed to avoid stopping your medications. Okay, that was the first thing I said. I'm writing, so get your pen and write. I said avoid stopping your medication abruptly. Okay, then the second thing, people living with heart failure or even anyone having any heart related disease and you're on medications. The first thing is that you don't need to, or you should avoid stopping your medication abruptly without even letting your doctors know, because you can worsen the ongoing heart condition. Then I said the second thing is to avoid taking too much salt. Avoid taking too much salt. Then 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 number three, I said do not smoke. Number four, avoid taking excessive alcohol. All right. And then number five, um, hello, hello. Should speed. Is it all monsters? Okay, I don't know what the monsters are. Probably it can come clearer. I don't know, in 2026. Oh, you mean all people in the world are monsters? Oh, no, no, no. All of us can be monsters, okay? Yeah, there are good people out there, so get those good people. Community living is very important for your mental health, okay? But then when you begin to see people as monsters, you don't appreciate, you not get the value out of people. So appreciate people, see the best in people, and live in a community where you're accepted and yeah, yeah. So the fifth point I would like to draw is um, avoid taking herbal medications or supplements without informing your doctor. So people living with heart disease or heart related conditions should avoid taking drug or supplements or some herbal medication. I know a lot of people take herbal medication, excuse me, and that worsens their ongoing heart failure. Yeah, in Ghana, okay, people will want to, like, people feel like once they are taking the doctor's medication, they need to supplement it with some herbal medications to kind of potentiate the treatment they are receiving. Even without informing the doctors, they go ahead to take these herbal preparations, being it boiled, being it chewed, or whatever, just to kind of help the kind of medicines given by the doctor. But also sometimes it kind of it kind of affects it causes like what we call interact with the medications negatively, or sometimes can make these medications that the doctors have prescribed not to work effectively. And sometimes some people even stop taking the doctor's medication and take these herbal medications because probably it has been advertised in, okay, okay, it says, oh, Clary, you are Chinese, right? Okay, Cleo Kayon Tabayong, you're Chinese? Oh, that's fine. I want to learn Chinese. I'm not Chinese, okay? But I would love to learn Chinese. So probably you can. Yesterday, um, uh, Nina taught me Arabic, and thank you was Mahaba, right? I can still remember Mahaba. So since you speak Chinese, Cheng Klin Kai Sin Klai, then they really get the name again. Clay Kayo Tabayong. Probably you can text in the comment section thank you in Chinese, and I would love to learn it. Okay. Yeah. I know my audience, the viewers, the live people with us also want to know something about Chinese. I mean, at least thank you in Chinese. So we all learn something new. Okay. I believe every day we need to learn something new. We need to learn something new to add up to what. Oh, okay. You are Italy or Philip. Oh, okay. Oh, okay. Okay. That's great. That's great. Okay. I'm also from Ghana. Ghana in Africa. Ghana. Yeah. So in Ghana we say thank you as medase. That is three. But we also have other languages in Ghana that we say thank you, like akpe in Ewe. Okay. Uh, uh, yeah, so basically that, but then the most important one we usually say is medase, which is three. Yeah, so I want to also know what they say thank you in Italy and Philippine, all right? Yeah, thank you. So don't forget, guys, to share this video to your loved ones. I'm Dr. OPJ, and we talk everything health. So I've mentioned 5 things. I said I'm going to give you 10 things that people living with heart failure should avoid. I've mentioned 5. Let's quickly go on. Oh, okay. Who won the World Cup? That's Spain. Spain won the World Cup, right? I'm right on that. They lost to Argentina. Yeah, Spain won. Apparently, I sincerely wanted Argentina should have win just because I'm a Messi fan anyway. But unfortunately, what I wished did not happen. But I think uh, I was so glad Spain also won. Yeah, and yeah. Yesterday, I think yesterday, is it Nanura? Cat, talking cat said he's a Ronaldo fan. Yeah, yeah. So probably Cleo Kayo Tabayong. Maybe I want to know whether you're a Ronaldo fan or Messi fan. So you can type in the comment section. Let me know. All right. Okay, so I've mentioned that. I've mentioned the fifth one. Let's look at the sixth thing you need to, people living heart failure should avoid. Yes, you need to avoid infections. Okay, so yesterday, or I mean yesterday back, we said infection also worsens heart failure, because usually when you're having infections like infection, upper respiratory tract infection with fever, urinary tract infection and stuff, the heart has to work harder to kind of okay, please can you come again? It seems I could not really get the emoji. Spain eats Indomie, right? Or Spark, or Spain won, and Argentina no food. Okay, something like that. Yeah, basically when you watch the I think I watched the World Cup finals. I watched there was a lot of emotion, there were a lot of tensions. I mean, Spain and Argentina, I mean, you could see that actually the 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 Spain really played, and obviously they deserve to win. Right from the first half, second half, and throughout, you could see they really played sincerely. It would have been nice if Argentina won anyway, but then Spain actually deserved, because of the game they played. It was really obvious. So they want some food, you want some pizza, but Argentina couldn't, you know. But just imagine Argentina won. There will be a lot of. All right. Okay, so that's the fifth one. Don't forget to share. What's this? Crab or lobster? Okay, do I love crab or lobster? I think so, the crab or lobster. I remember some time ago I was traveling and I bought lobster. I sincerely did not enjoy it. Yeah, I did not enjoy lobster, but then with crab, yeah, I think I enjoy crabs, especially if they prepare it with what we call okra stew. I love crabs, yeah. Yeah, and crabs are nice. Yeah. The beauty of crabs is you have to chew the shells before you eat the meat. And so that's why I love crabs compared to 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 lobster. If that's the images you are showing, is what it means. Oh, okay, octopus and squid. Octopus. Yeah, yeah. I sincerely did not see this image as well. Octopus. Hey, I've not eaten octopus before, and I've not also eaten a squid before. Yeah, yeah. I've not eaten both of them before. Probably maybe some time to come. If you package that to me, I'll be glad. Sincerely, I've not eaten octopus, and the way they are looking at their nature and stuff, I don't find myself eating that because it looks scary, you know. Nah, nah, I will not eat octopus. I'll not. But I know I don't know. Probably if it's a nice delicacy, you can let me know. It's a nice, squid also is very nice. You can let me share it in the comment section. Probably I'll go to get some and see how best I can prepare or get it being prepared and so I can take it. All right. So tell me, is it a nice delicacy? All right. Yeah. Excellent. Okay, so another very important thing is I've talked about 5 things. I said avoid taking your medications. Then number 2 is avoid taking too much salt. Number 3 is don't smoke, avoid smoking, excessive smoking. Number 4 is avoid alcohol intake. Oh, Claire Kayo Tabo. He said you are seeing I don't know what it means though, but eyes, mouth, and eye. I don't know what it means, but it means that something like I've not eaten it before anyway. Lungs, heart. Yeah, yeah, yeah. Yeah, lungs and heart. Yeah, we're talking about the heart. Yeah, the lungs and the heart has a relationship. Okay. And the previous time I said the heart and the kidneys are best friends. The heart and the lungs are also good friends. Okay. Does too much exercise also kill the heart? No, 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 no. That is one of the points I'm going to make about. So that's number 6. Number 6 is do not live a completely inactive lifestyle. Okay, so we recommend that even though the heart is failing, there are moderate exercises you need to do. All right, that kind of strengthen the heart muscles. Okay, apparently, if you remember in the live stream the last time we did, we talked about the prevention of heart failure. We talked about exercising as one of the prevention of heart failure, and I mentioned that exercising, you need to exercise 3 times a day. Sorry, 3 times within a week for about 30 minutes. So within there are 7 days in the week. Apparently, you are supposed to ideally exercise like 3 times within the week, and your maximum time for exercising should be 30 minutes. Do you get that? And this should be something you should be doing almost every week, and it has a compound effect in your future. So it's not when you get the heart failure that is when you be doing that kind of exercise, because when you are doing the exercises as at when you are having a heart failure, your heart is actually failing, and vigorous exercise can actually worsen or put pressure on the heart in terms of contraction and relaxation, and that can cause that can be even more fatal. Okay, so once you are living with heart failure, there are kind of exercises you are supposed to do that may not be like as when you were not having a heart failure in the first place. I don't know if I'm making sense to you. Yes. So does too much exercise kill the heart? No, too much exercise does not kill the heart. Just actually recommended you exercise 3 or 4 times in a week. But people living with heart failure needs to exercise moderately. So you need to see your sports medicine doctor on what best is good for you. And sometimes when you're exercising and you are tired, you need to relax, take breaks within the exercise, and that will be very important for people living with heart failure. So people living with heart failure, yes, they can exercise, they can do some walking around their house, take some breaks walking, but as to be jumping so high, running marathons, that would be more. That was just more pressure on the heart, and that is, yeah. So, hey, Cleo Kayo Tabayong, I could see you love food, pal. I don't know what this one means. The first image, can you tell me what it is? But I can see the brain, I can see the lungs, and I can see the heart, and I can see plus bowl, and I can see some smile. Yeah. So meat, brain, and something, but then the heart and the brain and the lungs are all needed, especially on the normal day. Okay, Abraham is asking, on the normal day for a regular person, what kind of exercise is advised? Okay, so with this one, I want to take it more careful. I'm not a sports um, into really sports medicine, but then on the normal day, okay, um, some aerobics, some cardio exercises are good, like aerobics, walking about, jogging. Yeah, jogging is very good. Cycling, riding a motor, I mean bicycle, that kind of motion can help the heart. So anything that has to do with cardio, like let's say push-ups or anything that will make you sweat, any exercise that can make you sweat is good. But it's not that you do this exercise vigorously, but you can take breaks. So let's say as I said, you need to do your exercise in 30 minutes every day for 4 times or 3 times within the week. In the 30 minutes that I'm doing the exercise, I can take breaks. So the first 5 minutes or the first 10 minutes, I'll take a break and I'll take another break. And then I can do not one exercise. Let's say if I'm doing aerobics, I can put in the push-ups together with maybe some, yeah. So basically those are the some. I'll try and find out more and how and what kind of exercise is recommended. Probably in our lives, I will do some exercises. We'll look at that. So let me write that down. Exercises recommended, and we'll look at some of the exercises that you should avoid. Okay, yeah, especially people living with heart failure, or people young people can do and older people should avoid. We'll look at those exercises as well. So that's one of the things I've taken note of. Okay, thank you so much for asking the question. I really appreciate. Okay, so I've mentioned 5, 6 things of exercise. Okay, let's look at the seventh one. I said I'm going to give you 10 things people living with heart failure should avoid. All right. Oh, Abraham, please, I don't know if I've answered your question. Yeah, yeah. Okay, yeah. So the seventh one, okay, is don't ignore sudden weight gain. Okay, so weight gain, I think the previous time I was talking about, I still mentioned that people living with heart failure. All right, thank you so much. Thank you so much. I said that people living with heart failure may gain weight, and that is as a result of fluid built within the body. So there's fluid retention, there's fluid built within the body. So initially, the person may gain some weight. So you could see that he will gain weight. And how do you know he will gain weight? You can see that the legs are swollen. Sometimes he has become edematous. His legs are swollen, his arms are swollen. And then when you check on the weighing scale, all right, thank you. Thank you so much. I really appreciate Mr. Abraham. Yeah. Yeah. So when you check on the weighing scale, you realize that the person has gained weight. So one of the things you begin to know is when they gain weight, they they are usually their shoes tighten them, and they have swollen legs. And so if you have any underlying health condition with your heart, or you know of anyone with battling with, let's say, hypertension, for a very long standing hypertension, and previous lives I said that hypertension is one of the leading cause of heart failure. So probably a person may be living with hypertension for a very long time, uncontrolled hypertension. He has not been taking the medication, or he takes the medication as he or she wants, and then he suddenly develops heart failure without he or she even not knowing. He or she may gain weight and may think that, oh, I've become fat, but not necessarily, but rather it's as a result of the hearts that has kind of failed, and so there's fluid overload. So, so if the person is weighing, let's say, 70 kilograms, maybe by tomorrow when you check, he'll be 73. Then it goes in that order. Okay, so what happened is that for us to know whether the weight gain was really as a result of fluid retention or from your normal, when we give you medications, okay, we will be monitoring your weight, and we expect that if really your weight gain was as a result of heart failure, we expect that every day you lose at least 1 k, or yeah, every day, or 2 days you should lose 1 k or 1 kilogram of your weight. And that can give us a picture that you were actually having heart failure. Your weight gain was actually as a result of heart failure. I don't know if you get a picture. It's like you are having heart failure, and then um, you have a lot of water. Okay, so let's say your body is like a bottle of water. Then because you have heart failure, there will, there will be like pure water, sachet of water inside the bottle, and then it will be overflowing. And so when we measure the bottle of water, you get, let's say, 5 kilo. But when you measure only the bottle without water, you get, let's say, 3 kilo. So that means that the water itself was weighing 2 kilo. Do you get it? So ideally, your weight was actually 3 kilo. But because you are having heart failure and there's fluid built up within your system, there's an extra 2 kilo that's been added to your weight. So when you check your weight, you may think you are 5 kilo, but it's actually water that has occupied 2 kilo. I think this is the best way I can try to explain that. So when you gain weight, especially your body, your legs are swollen and stuff, you should be mindful. Okay. Then the number 8. So we finish right now. Finish. Don't forget to share this video to your loved ones. Let's do that quickly. Number 8. Number 8. Don't ignore this um, um, stuff I've mentioned. All right. Number 8. I said, don't delay seeking medical care. Okay. Yeah. So when you are having heart failure and you realize that you are gasping for air, you're having difficulty breathing, you easily get tired, you feel like your heart is beating very fast. These are some of the warning signs, especially. Okay, yeah, it's going to end very soon. It's going to end very soon. Okay, so I've mentioned 8. I'm going to end very soon. So yeah. But you can ask me your question. Okay, I'm going to end very soon. Yeah. So just mention 1 or 2 things I've mentioned, and let's go. Drop it in the comment section. Okay. Yeah, I've mentioned, ignore weight gain, smoke and alcohol intake, no herbal medications, no ignore infections, and live completely in. And one of the thing, number 9, is live inactive lifestyle. That means you need to what? Your sedentary lifestyle needs to be avoided, okay, as much as possible, because sedentary lifestyle is one of the things that causes heart failure, or is one of the things that leads to Thank you so much. I really appreciate you joining the stream. I hope tomorrow you will join us. We do the stream every day. All right. Thank you, my good friend Claire Kayon Tabayong. I really appreciate your time. I don't take it for granted you joining us. I really appreciate. Thank you. And don't forget to subscribe to this channel to always get updated anytime we post something new. We have an amazing content on health, so kindly do so to join. I really appreciate. Okay. So on that note, if you have any question, you can answer about ending the stream. So you have gotten to learn about the 10 heart failures, the 10 things you need to avoid if you are living with heart failure. Thank you so much. Thank you so much. So I've mentioned all the 10, but just for Yeah, he said I should wait. Okay, you have a question, right? Okay, you can ask the question. We are all interested in hearing your question. I really appreciate. All right, all right, all right. Thank you so much. Okay, all right. You can come back to rewatch it again. All right. Thank you all, and I appreciate your time. So, bye. Thank you so much, my good friend, Mr. Brown.